was going to ask you one question about the anxiolytics. Are we also
Yeah.
going to look at when is it a good time to use them and when is it not? And what I mean by that is you were talking about public speaking, for instance, right? Some people get really nervous.
Yeah.
But some people may just take a pill when they could have just worked on it.
Right.
Whether or not maybe practicing in front of 3 or 4 people or just doing cognitive behavioral therapy, working on those thoughts, trying to change the thoughts. Right. Can we talk a little bit about what that threshold is when we cover that area?
Yeah, we can talk about the threshold as well. And also when it comes to, let's say, public speaking, when people take certain medication, that right there we can also distinguish between another category, anxiolytics, and something else that are called beta blockers. Beta blockers are anti-hypertensive drugs. So basically they bring down hypertension, which is another, if you will, version or form of agitation, right? But it's a physiological agitation. Heart rate, again, the symptoms are kind of similar. Heart rate goes up, blood pressure, pulse, etc. But it's more of a cellular, physiological phenomenon rather than a mental phenomenon, right? So that's when beta blockers can be very helpful because basically they calm down the body, not necessarily the mind, right? When they calm down the body, remember that anxiety or any emotion has to kind of be registered. Like feelings and emotions don't exist mentally. If you can't...
Oh, and that hurt my head. Go ahead.
Yeah,
Repeat that again.
There's no mental there is mental representation of emotion, but there is no mental manifestation or tangible evidence, if you will, or tangible record.
Like the heart rate.
Well,
Heart rate
mentally there is none.
Yeah.
Right? There's no heart rate in our mind. So therefore, in order to really record and register tangibly an emotion that we may call shame, guilt, fear, anxiety, worries, happiness, etc., you have to have an associated bodily experience. How can you feel happy if you don't feel it in your body? There is some symptom. There is some sign, more than symptom. In this case, we really talk about signs, more or less objective signs. Objective signs that there is something happening in you that can be recorded, more or less. There's a change of one state into another, and it can be recorded. It can be in terms of tactile sensation, right? So basically, skin conductance, that can be recorded. Electricity, sweating, blood flow, temperature, all of that can be recorded on our skin. On top of that, there are other things: pupil dilation, changes in, again, heart rate. These are all physiological changes that occur that are associated at the exact same time with a certain feeling. So if a person is going in front of a public forum and they're right there standing up there and they report to you, oh, I feel anxious, I feel worried, I feel embarrassed, or I feel like I'm choking. A lot of times people say, I can't speak, I'm choking. That's again a sensation, a physiological sensation. What if they didn't have that? What if you stand up, you go up to the podium, and there is no sensation going on? Everything is fine. Everything is normal. There is no heightened blood pressure or heart rate or pulse. There's no sweating going on. There's no choking. There's no physical sensation that is out of ordinary. Like you feel just as much, as good, as calm, as relaxed as when you were sitting in a chair an hour ago.
So it sounds like medication has a place at times.
Absolutely.
Because by reducing those symptoms physiologically, that would help the person.
Right. So in this case, using beta blockers, we are kind of tricking the person.
Yeah.
We're tricking ourselves. We're tricking ourselves about the public speaking anxiety by circumventing the physiological symptoms and effects in the first place. So what happens is our mind tells ourselves, there is nothing wrong. Everything is fine. And as a result, the mind then follows and delivers the job. It's not interrupted by all the stimuli that come from our body because we have calmed the body. So beta blockers have that type of effect because they're the antihypertensive